I'm Ray, and I'm in Granite Falls, North Carolina. When we moved here to North Carolina, we found our current primary care doctor, and we have a really great relationship with him. And he happens to be a friend and a neighbor as well as our primary care doctor, and that's been really great. He cares a great deal about us and all of his patients. And I mean, I've had, to be referred to other specialists at times. I have a pacemaker, and before I had a pacemaker, I was experiencing at a point in time syncope. I would randomly pass out and fall down. So I was with some friends, and they said, you better get to see see your doctor. And I said, yeah, you're right. And so I went to see him, and I told him that he either needed to find a solution to this or prescribe a helmet for me because I was getting lumps on the back of my head. So he immediately did some checking and said, I need to get you to a cardiologist. I've been seeing that cardiology group now for about 10 years, going back for periodic checkups and so forth. In fact, I've had my second pacemaker installed just this past year. So that, and I've been to a urologist, I've been to eye, ears, nose, and throat. I have some eye issues, and so he recommended an ophthalmology group, and his recommendations mean a lot to me because he's been in this area for about 30 years and knows most of the people and most of the other medical practices and what's going on in each of them. And so his judgment means a lot to me. So I really value having my primary care doctor as a quarterback to tell me, to sort of run the place, to help me understand uh, who are the best specialist providers in the particular area that I need. And not only does he have a good sense of who are the best to deal with the kind of issues that I have, as well as to stay in touch with what they are finding and dealing with, because it helps him understand what I may need in other areas going forward. So I think that's been very valuable and helpful. Having a doctor that understands me as a person um, and my family. Well, in this case, it's only my wife now. Our children are gone in new directions of their own, but having a provider that understands more about me than just what happens to be wrong at the moment. I mean, and that was kind of my experience in the military days was, okay, what's your issue? Why are you here? But so he understands much more about me, and he knows about my blood pressure issues. He knows about my heart and pacemaker. He knows about pretty much everything, any kind of service that I've needed other than the private that he provides. He knows about, and so he knows the bigger picture and the where the puzzle pieces fit, and I think it certainly makes me feel more comfortable that he knows where I need to go if I need a new treatment process or something like that. So, and not only does he know about me, but he knows about my wife. Mental health care in our area is pretty scarce. And so our primary care doctors need to be able to deal with as much of that as they can. So I just think that's an issue that goes unnoticed sometimes. That primary care is more important than they've been giving credit to it. And secondly, they need to make the life of primary care doctors easier.